All right. So, as it says, raising the next generation together, we are very much and have been for quite some time very invested in a multi-generational approach. We know that by helping the parents or the adult caregivers, whoever they may be, that the benefit ultimately is the child. We are totally committed to trauma-informed care and have been for quite a while. And of course, I'm sure you're all familiar with adverse childhood experiences, that study. And if somebody just wants to say yes or no, because I can't see you, but I'm assuming that that's something that y'all.
Yes.
Okay. Well,
Yes.
I became a trainer right after I came to work for the agency, and up to date, I can't tell you how many groups, but I know that I've trained around 5,000 people so far. So that's something that I still like, but I still do as often as I can. And I will say up front that nothing that we do costs anybody anything, as far as like if we're doing classes or facilitating meetings or whatever. And then of course none of our services cost anything, and there are no insurance requirements. There's no income minimum or maximum. Really, all you have to do is meet a couple of the conditions that the Department of Health lays out for services. And so, if it's your first child, or if it's your first child, if you're having a child and you're under 21, or you're on SNAP or any, I think there's like 6 conditions altogether. Uh, our assessments are set up where it's almost impossible not to qualify, because we know that, and I have 4 children of my own. Each one of them has been different. Each one of them has brought new challenges. So we know that almost any family can benefit from some kind of help. And we kind of look at our family support specialists. They're sort of like coaches. We're not there to tell anybody what to do. We're there to provide education through right now, our primary curriculum is Growing Great Kids. And that covers, let's see, well, from prenatal to the age of 5. Our admission criteria does include, um, you know, you can enroll as soon as you find out you're pregnant. We don't really start gearing up services until the last trimester. And then we prefer to enroll people before the baby has reached 3 months. But we can make exceptions up to 6 months, and we do so. We are right now. We have, in addition to the Healthy Families America, which is our umbrella that we operate under as far as our home visiting services are concerned, we have also recently become accredited to provide parents as teachers our in Davidson County in our Middle Tennessee region. We don't have that here because we have parents as teachers. We have a provider here in Hamilton County, and I think there's parents as teachers is also in Knox County, isn't it? Does anybody know?
Yes, it is.
Okay. Well, I mentioned that because we partner with them. We actively seek out partnerships with other evidence-based home visiting programs. There's only 3 in Hamilton County right now. Mine's the only one that operates outside of Hamilton County. Um, so we also refer to Nurse Family Partnership, and cross referral with Nurse Family Partnership and with Parents as Teachers. And of course, Parents as Teachers takes kids up to 5. So there's a little more flexibility there. Um, so as it says here, we nurture the next generation. Parenting does matter. As I said, I've got 4 kids of my own. I will say one unique feature about my family is that all 4 of my kids were born in different decades. My oldest son turned 45 yesterday, and my youngest son turned 19 week before last. So they're stretched out pretty far. But as I said, They're all different, and we know that's true for everybody. So we just want to make sure that the families have the skills and the confidence that they need to create the kind of environment that they need for healthy development. Our mission is to create a future for children and families filled with promise and prosperity. Our vision is to see all children in Tennessee thriving in safe, stable, and nurturing families and communities. And how we do this is with our work. We provide hands-on support through home visiting. We create lasting impact by working with parents and their children, reaching two generations at once, and sometimes more than that, because we have a fairly large number of our families have grandparents are involved in the caregiving, if not as primary caregivers, but living in the home. And so, we're working to change the landscape for families through advocacy and education. So I'm sure this is all familiar to you, so we won't spend too much time, but going back to ACEs, abuse, neglect, household dysfunction. As I'm not sure when the last time you went to one of the ACEs presentations or whatever, but you may remember that the statistics that came out of the survey done in Tennessee in 2016, I believe it was, were very, very close within just a very few percentage points of the ones that were found in the original study in San Diego. So, we know that sexual abuse is common, unfortunately. We know that there's plenty of neglect, mental illness. One thing that we have found out since we've been doing this work that I was really kind of shocked by, but I guess really not surprised in a way. Incarcerated relatives, the rate of incarceration here in Tennessee is, excuse me, about 15% of all the parents in the state of Tennessee have served time in one type of facility or another, which is much higher than the national average. And I think we're ranked third in the country as far as that's concerned. We do our visits. We visit the families in the homes, depending on what level they're on. We start off ideally before the baby has been born. We want to get in. We want to go ahead and start laying the groundwork to make sure that the caregiver understands, some of the things they may be dealing with. We want to make sure that the mother is getting proper nutrition and medical attention and has a doctor. And kind of start laying the groundwork for what happens afterwards. We'll see them, once a week. And then that continues until they move from prenatal to level one, and then from level one to level two. And level one to level two usually takes somewhere between 3 to 6 months. We, we let the family kind of determine that. We watch their progress very closely, and we let them progress at their own speed. We work on building parenting skills. We do a lot of work around, obviously, brain development, physical development, relationship building, communication skills. Gosh, I can't remember all the different categories, but each visit incorporates some sort of activity that helps reinforce the concept that we're discussing at that point. We're real big on serve and return. So one of the things that our family support specialists are doing as they're in the home is, they're going over this information, they're showing them activities, and we have interaction with the infants, but most of our communication is directly with the caregiver. We're not there to babysit or anything, but we can, give them tips and sort of help them along. But we do a lot of observing. So we talk about we go over the different lessons. We do the activities to help reinforce those ideas and those concepts. And then we observe how the concept is being put into play in the home. So, for example, one of the things that we're always watching for is how long does it take the caregiver to respond to a cue from the child. So if the child starts crying or starting to ask for attention, how long does it take the caregiver to respond? And then we keep copious notes. We're evidence-based, and I'm sure all of you know what that means. But we collect a tremendous amount of data. We are, let's see, we just had an accreditation from Healthy Families America in our East Tennessee office, the one in Oak Ridge, back in, let's see, November. And then we do QA visits once a year with Healthy Families Tennessee. The All of the Healthy Families organizations in Tennessee recently came together under the umbrella of Healthy Families Tennessee. So now we're like one large site with, I guess, I don't know what you call it, individual subsites or whatever you want to call them, satellites. And I can't remember now how many there are of those. But how many of you have you worked with Helen Ross McNabb?
Yes, we have.
Okay, because they're
Yes.
they're the other they're the other EBHV, and they're by far the largest in East Tennessee. Well, except for us, like I said, we still have a larger caseload, but we're starting to partner with them. And again, on July 1, we will begin sharing Roane County with them. And we're kind of hoping that as time goes by, we can work on that and kind of going in both directions to try to provide as much coverage as possible. Because even though my staff has grown significantly, we all know that if I had a staff of 200 or 300, we probably still wouldn't have enough people to take care of all the families that that really need it. Um, let's see here. So, work to build parenting skills. Again, we work to reach two generations at once: the adult caregivers and the child. Sometimes, though, it may reach into even more grandparents, aunts, uncles. We're happy for pretty much anybody who is involved in the family, who is involved in the rearing of the child, to get involved with us. And then we partner with a very wide array of agencies and businesses. Over the last several years, we've had a lot of success here in this region, reaching out. We work very closely with United Way, and any number of other nonprofits. As I said before, we work with the other evidence-based home visiting services. We have one home visiting service here in Chattanooga that's not evidence-based, and so if we can't get an EBHV provider, we do have that to fall back on, and they do a great job. It's more case management than anything else, but that's a vital service too. And as I said, we're working on a partnership with Ronald McDonald House, which I'm very excited about. And let's see here, and like I said, the other evidence-based home visiting services. And then advocate and educate. We have, in addition to just the stuff that we do on a day-to-day basis with the families, we do have a lobbyist who spends a lot of time on the Hill in Nashville, and then we have a parent leadership program where we recruit families, not just from us, but from people who have received services. And we work with training them as advocates for children and for legislation that benefits children. And, we have stipends available for people who do it a certain number of hours. So, we're just trying to spread the gospel as much as possible. Any questions so far? Okay. All right. I'll tell you what I used to tell my kids at the psychiatric hospital I worked with for a long time. I may have missed my calling as a preacher, so I can go on for hours at a time. So if you need to break in, please feel free to say something. So, okay. So in-home support, we have long and short-term programs. Uh, we meet them in the home, and that helps us remove barriers for families. I'm sure that I know that y'all are working in a lot of rural areas, and probably in the greater Knoxville area as well, and the other other urban centers that you have. Transportation is a problem, period, because most of the families that we work with are have economic hardships, but in the rural areas in particular, it's a major problem. And so by going to them instead of having them come to us, it makes it much more likely that we can meet on a regular basis and be more successful. And we're working in the atmosphere that the child is being raised in, so that gives us more insight, more information about the families, about their situation. Um, we know that the first 5 years of life and plus that last trimester, especially before birth, is really critical. That's when their brain is developing the fastest, and so that's why we focus our work on families with young children. We were getting a little more into, and we still do it. I'll tell you about this in a minute. We have a parenting class that we do for free, but in the last year, we decided that we really want to narrow our focus on what we feel is the most critical, which is that first 5 years. So we still have the nurturing parenting program, but we're kind of doing that on a year-to-year basis. I don't know. I'm not sure how long we will be doing that, but I'll tell you more about that in a little bit. We work to build parenting skills. Now, I'm sure that all of you have gone into homes and like us, you probably have to do some work uh, trying to re-educate parents on the best child rearing practices. I mean, I love my grandparents, I love my parents, but as much as I love them, none of them were perfect, and I still haven't met any perfect families or perfect parents. And we know that in the rural areas for us, especially, there's an awful lot of misinformation, and that's frequently being handed down from great grandma, grandma, mom. Um, One area in particular that we struggle with at times is trying to promote positive discipline skills as opposed to the old take them out behind the barn and get the belt out kind of approach. So you know, our ultimate goal, again, is to provide a safe, stable, nurturing environment, but also to break those cycles that families set up where they're handing down misinformation or less than the best parenting practices. And ultimately, that leads to a great reduction in trauma and also, in reducing exposure to adverse childhood experiences. And so our hope is we set up a sort of a almost a self-sustaining system. So if we can improve the lives of the children we're serving now, help them become better parents, and then so on down the line. So we try to make things better for all of our future generations. I mean, I know that, as I said, I've got 4 kids of my own. I know that since I have been in this field, which is 30 some odd years, um, I've learned a great deal about child rearing. And I will say that that I have had more than one conversation with my 2 oldest children apologizing for some of the errors that I feel that I made as a father when they were growing up. I know that I didn't always use the best approach. And so, unfortunately, they've forgiven me, and hopefully, they're doing better with their own kids. So, that's what we want to do, is we want to do that for everybody. Reach 2 generations at once, including support in a crisis. We're committed to ending cycles of violence by meeting parents where they are when they need us. And now this, we no longer operate the 24-hour helplines. That's something that we moved away from at the end of this past calendar year. Again, so that we could kind of focus more on what we feel is our most important role, which is the home visiting. But there is still a Tennessee Domestic Violence Helpline. I'm not sure. I think the Parent Helpline is still in existence too, but we no longer operate it. As I said, we partner with agencies and businesses. In Knoxville, for example, we have a really great relationship with Helping Mamas. Are y'all familiar with that nonprofit?
I've
You
not
can,
heard of that one, Richard.
yeah,
Oh,
you
you
can tell us
haven't?
more.
Oh, well, they're a great organization. In fact, their director sits on our regional advisory board. Uh, and and this is one of those things, we really encourage our family support specialists to take initiatives and to look for opportunities to partner with other agencies and other businesses. And this one has come about to a very large extent due to the efforts of our family support specialists. One of the two that we have who work in Anderson County, she lives in Blount County, but she had gotten in touch with Courtney Nyman at Helping Mamas. Helping Mamas is, and you should, take a look at, the websites. There's not a whole lot there on the website, but basically what it is they gather supplies. It may be baby beds, it might be clothes, it may be diapers and wipes and any number of different things. And really, all you have to do is just let them know you need them. And they do a thing where they have a form that you can fill out. They do prefer that agencies that have multiple employees or multiple staff out there in the field, that they, sort of consolidate their orders and then have one person go and pick it up. They don't always have the same thing from month to month. It kind of depends on the supplies, but they don't charge anything for any of the things that they donate. We just recently helped them with a diaper drive where we donated diapers and wipes to them to hand out to other agencies. Um, but they're a great organization, and I would really recommend that if you've got folks working out there, like I said, working in homes, get in touch with them. Like I said, doesn't cost anything. Super nice folks to work with. Um, let's see. As I said, we have talked in the last few months. I don't know. I'm hoping this comes through. For example, here in Chattanooga, we have several YMCA's, and we've had discussions with the CEO who is considering providing free memberships, annual memberships for families. So we're trying to work that out. But we're looking for stuff like that all the time. Um, we know that, I mean, what is it? Well, build, it takes a village did not originate with Hillary Clinton or anybody. I mean, it's been around that concept has been around as long as there have been indigenous peoples, and we feel that's what it really takes. Is I mean, for example, I mean, I feel like I'm responsible for every kid that's in my community, because these are the kids that are growing up with my kids and my grandchildren. And so I want things to be better for everybody. And that's pretty much that's our point of view as an agency. So if we can find somebody else that does something better than us or that can help us do better, we are happy to work with them. And so again, here in Chattanooga, we do cross referrals with parents as teachers and nurse family partnership. I'm a real big believer, like I said, coming from a psychiatric hospital that was a residential facility for children and teens. You know, me being the one who provides the service is not the most important thing. Getting the family or the patient the service that they need, that's the most important. So we have no qualms and no hesitation about working with others if we feel that they're better equipped to handle a particular case or particular need. Then we're happy for that to happen or to help facilitate that. Advocacy and education. As it says, it does take more than parents to raise healthy, happy children. We provide education across the state to share ways that everyone in the community can support strong families, keep children safe, and we advocate for further public investment in evidence-based family support programs like home visiting. So our CEO, Kristen Davis, excuse me, is very active uh, on the Hill, and we have other people too. As I said, we have our own lobbyists now, but we do regular visits, and we harass our legislators as often as we can to get them to take action and to support legislation that we feel is necessary to help families. And Another thing, like I said, going back to education, we have the Nurturing Parenting Program, and that's a program. It's basically 5 modules, and we can sort of flex how we do it. As far as like, you know, we're not really big on doing all of them in one day because they're really feel that that's more than most adults can kind of take in and absorb and then sort of store it away for future use. So we like to do like maybe 3 classes, a series of 3, or even better, a series of 5 where we're doing each module separately. We do the ACEs questionnaire at the beginning to find out what may be the issues that some of the parents are dealing with, because we do know that about around 2/3 of all of the parents and caregivers that we work with do have ACE scores, some of them pretty significant. And so we do that. We also do, oh my gosh, right now the assessment that we do. We do one at the beginning and one at the end. We're assessing their parenting attitudes and their approaches. And so we're always looking, we want to see that we can see improvement. And so it covers a pretty broad range of things. But again, I'll go back. One of the ones that we find people seem to sort of that resonates with them the most, or that concerns a lot of them, again, is how do you discipline a child without it becoming punishment. And so we focus a lot on that. Let's see here.
Mr. Tate, we have a question.
Yes.
Do you teach ACEs and how it affects brain development?
Oh yeah, yeah. And that would be me. I mean, when I first did the training, like I said, I'd been working in mental health for a long time, and uh, I mean, I've been working it long enough to remember when the discussions around trauma really kind of started to ramp up. Up until a certain point in time, until the very late 1900s, early 2000s, trauma was usually thought of as a physical condition. So, you think about, okay, I've been in a car wreck or whatever. Okay. And only in certain instances where you're talking about somebody really being traumatized in any kind of mental or emotional capacity. But that changed when we started getting involved in the Gulf War and in the Middle East, and we started having a lot of military personnel coming back with not just traumatic physical injuries, but also exhibiting a lot of trauma-based symptoms in their sort of like daily lives. And I remember that probably the first article that I remember reading in a journal was written by a social worker who had come back from, I want to say, I guess it was Iraq, and was with his wife on a Saturday afternoon, and they live in a small community, and they've gone downtown and they're at the farmer's market. He's walking through the farmer's market, and all of a sudden he noticed he's like on guard, and he's scanning the buildings, the rooftops, and he's watching people to see if he can detect whether or not they're carrying explosives. Well, that's probably not something you're going to usually run into downtown Sweetwater or Maryville or whatever, but it kind of alerted him. And so he started kind of putting connecting the dots. And for me, I was at the time I was working with a lot of kids. Our average age of admission was 14. We had 64 beds. They were full 24/7. And started linking that to what the stories I'm hearing from these kids. And it's like all these things kind of started falling into place, started to make a lot more sense. So it's not just necessarily like organic brain disorders or mental health issues that are just, like I said, organic in nature, but these are things that are coming from external forces. So when I came to work for Nurture the Next, which was Prevent Child Abuse Tennessee at the time, one of the first things I did, because that was when Governor Haslam, his wife especially, was very, very instrumental in the promotion of ACEs education in Tennessee. And we had a summit here. We got to meet with her, and there was a lot of support in Tennessee for it. And I don't know, you probably aren't aware, but at one point, Tennessee and Chattanooga in particular was like the epicenter of ACEs education and policy and practice in the public in the country. So we were very proud of that. We banded together with some of the other trainers and kind of set up a network and working on right now with a young man who works out of the mayor's office. We're trying to kind of rebuild that. Um, but anyway,
Mr. Tate, I was wondering if you taught that, like, do your home visitors teach that to the parents? I know
well, they don't do
you
the
said-
whole course. They
Okay.
do give them information about it. And then again, like I said, we do assessments. And our let's see, are y'all using the frog?
I don't know what that is, so I'm gonna say no.
It's family resources. I'm terrible with acronyms, but that's our assessment tool, and it goes very much into that. And it's kind of we ask a lot of open-ended questions and let them tell us their story, and then we gather from that, we glean from that uh, incidences from their childhood and their their adolescence or whatever that may have effects on where they are now, and especially that may have effects on their kids. But as I said, I mean, I've told people forever now that if you can get a group of people in your living room, I will come there and I will be happy to do a training for you. Like I said, again, no fee, no charge, because I think it's that important. All of our folks have been trained in it, but not as trainers. So we only have a handful of those. And unfortunately, or fortunately, I mean, it's kind of moved away from that now. Are y'all familiar with Building Strong Brains? Have you heard of
Yes,
that?
yes.
Okay. Yeah. The emphasis there has shifted more towards resilience practices, which is a good thing. Unfortunately, they haven't quite followed through the way we'd hoped on curriculum. So it's not as organized as it was when we were just focusing on ACEs. But if you're interested in working together to try to put something together that your folks can present, then I'd be happy to help with that.
Mr. Tate, we have another question.
Uh-huh.
Is it results of the frog that help match a family to a program since a variety is offered? If not, what determines it?
Okay. Well, we feel like, I mean, now we can, if somebody doesn't want to do the weekly visits, because for a lot of folks that's a little bit more, and then and I'm sure you've all run into the fact or have heard from one family or another, you're just here to try and take my kids. And unfortunately, a lot of people have had very unhappy encounters with the state system and and with law enforcement or whatever. So we have to kind of overcome that. And then there are a lot of folks that are very self-conscious about the homes they live in or whatever. So we do everything we can to accommodate and to make it easier for them because we really do. It does best for us to work in the home. Um, so when we do the frog, we do go into like, okay, if a child is 9 months old, well, it's there's no question we can't offer home visiting in those cases, unless they're living in an area where we provide parents as teachers. And even then, at 9, we can't do it because that's outside the range. But we can steer them in the direction of the education program of the nurturing parenting, and that's the one where if you have to have a child in the home who's under the age of 12. That does not have to be the quote target unquote child, but there does need to be a younger child in the home because we want to do whatever we can to benefit them as well. So most everything else though about it is like I said, it's are they qualified? Is the home visiting service is this something that we feel is going to be beneficial for them? And in most cases, I mean, we've worked with very wealthy families. We've worked with the poorest of the poor families. And again, I'll say that I don't know anybody who's got kids who couldn't use a little extra guidance from time to time, or input, or just emotional support. And that's what a lot of that's what our family support specialists find. A lot of time it's, and I think you heard in the video, the woman felt something like, she said, it's like family. It's having somebody else is there who's on my side. And we get a lot of that feedback from families about how they don't feel alone anymore. They don't feel as overwhelmed. And especially, and I don't know about you, but we work with undocumented families. We have no qualms about that. And so it's a little bit tougher for some segments of the population. Again, with families that don't speak English as a first language, there tends to be a little bit more suspicion about people coming in from outside. But once we get started, if we can establish that relationship, then we have really good retention rates. And we just had a graduation. It was really neat. We do graduation ceremonies, and so here in Hamilton County, just about 2 weeks ago, we had a graduation ceremony where we had 10 of our kids graduate. So that means they were there from at least under the age of 3 months. Some of them all the way up to the age of 5. So we feel that that's a testament to what we do. Plus, a very large percentage, if not the majority, of our referrals come from families or friends of families who've received our services rather than institutional referrals. In fact, in most cases, are y'all familiar with CHANT, the state referral system that's run by the
Yes.
Department of Health?
Yes.
Yeah, I mean,
Yes.
we in most of our counties we have asked them, we don't rely on those. We do just as well or better with the what we call self referrals. And so we feel, again, that's another testament to the work that we do, that people are enthusiastic about referring our services to their friends, to their family members. And we also have occasionally, we have somebody, they've had one child, that child is a few years old, they've gotten out of the program, and then they come back, it's like, okay, I've got another one. Okay, we can work with that too. Let's see here. Any other questions?
We have another one. I think we have
Okay.
two. Sissy, you can go
Okay.
ahead and do yours first.
Sure. I'm curious if, at least for East Grand region, since you're more involved, Richard, with East Grand region, what
Mhm.
proportion of the families that participate in any program have child welfare involvement? And I'm also curious to learn a little more about how decisions are made for healthy families, and what families would benefit from that program, and the referral process for
Okay.
that.
All right. Okay. Well, now we do have, if we can't take cases or like nurturing parenting, we can't take cases where there's an open investigation or where someone has had an allegation made about child abuse or neglect. All right. We steer away from those. Uh, and then, but as far as the home visiting services, um, we're mandated reporters, so we do occasionally we find ourselves in a position where we have to make reports. And most often that's in the interest of protecting the child and sometimes the family as well. We get a lot of, I'm sure you've seen this. A lot of landlords are less than scrupulous about the kind of environment that they have, that they're providing with their rental property or whatever. Whether it may be insects or just generally rundown conditions and things. So we will do referrals. Um, Let me see here. I'm trying to get back to the question. Okay, again, we use the frog, that initial assessment. That kind of steers us in the direction of what the family needs or what their issues may be. And then we have like a constant dialogue going in, because again, like I said, these folks are, you know, we have family support specialists working in homes for years at a time in some cases. So they really get to know the family very well. But as far as like child welfare, you're talking about the Department of Children's Services. Is that what you're referring to?
Yes, and specifically you mentioned open investigation. Let's say cases where there an investigation and there has not been a removal, but the decision has been made to provide some supports to the family.
Oh,
And
yeah,
there is a plan put in place for some
right.
supports to the family. So there is still some involvement, but it's not that the child is not, so it's more prevention services as opposed at the aftermath of a referral.
Right.
Yeah.
Well,
Do
we're,
you,
yeah,
do
we're
you think?
happy to work with those, and we have those situations on a pretty regular basis where things come up. Um, but and we want to work, we feel like, I mean, it's pretty overwhelmingly, been proven. I mean, kids are always going to do best with their families if the families are in a situation where they're able to provide the kind of nurturing and the kind of environment that the children are going to thrive
Mhm,
in. So we want to do everything we can. And again, it goes back to, I mean, the multi-generational approach. I mean, a lot of parents, I mean, I think, it's been my experience that most abuse happens out of sheer frustration. People they're
mhm,
overwhelmed. They're undereducated about how to work with their kids. And so, things come up and again, also, it's like, I've been doing this for a very long time, but, put me in a
mhm,
room with a baby that's crying for 2 or 3 hours and I'm liable to start climbing the walls myself. So we understand that. And so we want to try to do whatever we can to offer the family alternatives and to help them set up, for example, systems like, okay, who's your backup?
mhm,
If you just can't get the baby to calm down, or you feel like, you're getting to a point where you need a break, who's that going to be? Who's that backup going to be? So we try to help set up systems like that. And we definitely want to work with families as much as we can to help keep them from being separated.
mhm,
And well, in fact, I have a case that one of our family support specialists, she's one of our bilingual staff. She works out of Ray County, and she had a young lady, a mom, who is who was expecting and had already lost 2 kids. And this is a very young mom. I want to say she's like 20 years old. So she's already had 3 kids at this point, and 2 of them had already been removed. And her greatest fear was that her living situation was untenable. We could not, they couldn't get the landlord to do anything about it. She wasn't living in an environment that was really safe to have the children. So while it's a little outside of our scope, our family support specialist worked with her and tried to help her, and they did end up finding a place for her to stay with her grandmother. And her grandmother has other relatives in the house. There are a lot of folks living in the house, but it's clean and it's safe, and they've got food and utilities and everything. So the girl was worried about losing her third child. Well, not only did we were we able to help her prevent losing that one, but she has custody of the other 2 now. So they've been returned to their mother's care. And so that's, for us, that's a major success. So,
mhm,
we're happy to work with them. Like I said, if they've got, if there's an open investigation, if there's been an allegation of abuse, neglect, we can't get involved
mhm,
there, especially with the nurturing parenting. But
mhm.
So you're saying none of your programs will take a
oh,
family
no,
with
no, I
open
said
kids?
nurturing parenting, we can't.
Okay,
Nurturing
but
and parenting we
the
can't.
home
Now
visiting you can.
right, I mean, we take referrals. I get referrals from Department of Children's Services on a fairly regular basis, and it kind of depends on what they're, what they're wanting. But um, and we would also factor in, I guess what the circumstances, what the charges are. But for the most part, yeah. I mean, like I said, nurturing parenting has restrictions on that. We can't take someone who has an open investigation or has been previously convicted. I'll add that too. But for the healthy families, yeah. I mean, we want to do everything we can to help keep the family together. Or we don't take part in many reunification cases where the parent doesn't have any of the children, because one of the tenets of the program is the child needs to be there. So when we do a visit, it needs to be with the parent or the caregiver and the child present or in the home. So there's that distinction, but other than that, yeah, I mean, we do everything we can to stretch ourselves to the limit as far as, you know, who we can reach and who we can provide services to.
I
Okay.
know
So if we're working with DCS, would we need to make sure that the workers reach out and talk to somebody about the situation of their case instead of just say emailing or faxing a referral? Because I've had some DCS staff tell me that they've made referrals and been told that, well, like they don't know what happens to them, or they've been told that they can't work with them because of the open case. But what I'm hearing is that it may be a case by case situation.
Yeah, there's more. I mean, it just, you know, we try to avoid just like a blanket thing. But again, like now with nurturing parenting, which is the free parenting classes, there are restrictions there that are pretty hard and fast, and we can't accommodate those. But on others, you know, a lot of times we'll get cases, for example, where there has been an investigation, there's been something going on, but now Department of Children's Services feels like the home is safe, and they want to start kind of trying to like move out of the family's life. And then that's, you know, that's where we can come in there and kind of help pick it up from there. And again, we're all, I mean, of course, every adult in Tennessee is a mandated reporter, but that's something we take very seriously. And we make that clear to the families going in. If we see something that we feel is preventing some sort of a danger, or is, you know, neglectful or abusive or whatever, we there's no question we're going to report it.